We can't wait to rebuild in 10 years. We will lose generations of patients.
So let's do try to pivot into, I think that's a good transition into, so now what? You know, it's sort of the now what of it all. Here, you know, you've been having conversations with policymakers, laying out these sort of impacts, you know, what are the messages that you think are being, where there's some receptivity to those conversations?
Yeah, so the first thing is we still have some infrastructure that has been really successful. So many of you helped with this. We advocated for the existence of the Rare Disease Innovation Hub that was stood up. It was stood up last July. They set a strategic agenda that was published last fall, or published last winter, but in the fall, they took in all the guidance and suggestions from the community, and I know many of you submitted to that. That is still standing, and actually really aligns very well with priorities of the Trump administration. We also know that our Congressional Rare Disease Caucus is really supportive of ensuring that that is resourced. And that is something that as a rare disease community, we are going to be really pushing for some appropriations and additional resourcing for the Rare Disease Innovation Hub. That is something that members on both sides of the aisles who we're talking to right now have been very receptive to, because it does align with some of that reorganization that Carter was talking about previously. We do have to make sure, though, that those expertise that we need to support regulatory review exist within that Innovation Hub infrastructure. So that's something that we need to be certainly talking about. Within NIH, we also lost some key NIH leadership at NIH, but we have retained some really critical leadership. So NCATS is still, we have Dr. Rutter still at NCATS. We have some key leadership within NCATS. One of the things we're worried about with the elimination of some of the contracting, that's really critical at NCATS. So again, we're not sure where all the dust has settled with some of these changes yet, and we know there will be more. But I think we are very actively on the Hill, really pushing hard to protect some precious resources right now. And I think we are definitely getting the attention from lawmakers that there has been significant damage to our rare disease community already, and we need to protect what currently exists. And we do have some leaders standing up and helping us fight for that.
Jenny, same question to you.
Sure. Another argument that also resonates with policymakers, in addition to the real human impact, is the economic impact. And so that's something that, you know, we've been working on with our universities. Someone just sent me a district by district map of how much NIH funding there is.
Oh, I'd like to see that.
Which is, I've never seen before. You can get it by state, but not by district. It's also by county. So really zeroing in on where this money's going, how it's helping patients for sure, but why it's also important to the local economy. So that's another messaging area. Part of what's happening too, though, is that for a long time, non-scientists, the greater public, let's call them, have felt quite separate and apart from the academic community. And so some of that is coming home to roost. That's not necessarily the impetus for what the administration is doing, but why aren't, you know, a scientist said, well, why aren't people taking to the streets? Well, you know, one, they may not be aware, but two, when was the last time you actually explained to someone who's not a scientist what you do? So a lot of what we do at Research America is we train scientists and work through science societies and through universities to prepare scientists to engage with the public. And there's lots of different ways of doing this, but that's a really key thing. And that's something that we can do regardless of what's happening at the federal level. Like, we just need to do that. You need to do it in New York, even though you have a lot of support from your lawmakers. But you've got a lot of folks in New York whose taxes are going to research, and they don't know what, you know, what it's being used for. You know, we say that a scientist should say to a policymaker or a taxpayer, I work for you. So that's something else that we're promoting and have been promoting for a long time.